Hello, everyone. My name is Breideband, and I'm here to present our work on sleep patterns and sleep alignment in remote teams during COVID-19. As we're all aware, many information workers and their teams saw their daily co-working experience radically change with the sudden shift to working from home. Considering the kinds of forcing functions that typically exist when working in an office and are absent when working from home, that is, the daily commute, for example, or shared work hours, several studies have shown that work schedules became less rigid and more fluid during the pandemic for those who worked from home. Other studies have also indicated that work from home policies impacted general sleep behaviors. In this paper, we studied sleep and remote teamwork from the perspective of team alignment, specifically temporal alignment, and how differences in sleep patterns between members of the same team may be related to individual perceptions of remote teamwork. Therefore, our study asked the following research questions. First, how is the shift from co-located work to work from home related to sleep and work patterns of information workers? Second, what is the relationship between individual sleep patterns and perceived team performance, team productivity, and individual affect mood? And third, what does the misalignment of team members' sleep patterns reveal about their individual mood as well as their perceptions of teamwork? With this in mind, we analyzed 10 weeks of daily sleep and survey data for 71 information workers who belonged to 22 teams. Alongside the wearable sleep data, we collected participants' daily perceptions of team states, team processes, team productivity, and personal affect via surveys sent to participants' smartphones. Team states included team members' views on cohesion, climate, and conflict, whereas team processes referred to their perceptions of communication and coordination in the team. To answer our research questions, we built linear mixed effects models because of the repeated design of the study and the complex nested structure of team members nested in teams. However, for RQ3, which looks at sleep misalignment, we also conducted a thematic analysis of interviews, specifically those with participants who belonged to the most and least misaligned teams. For RQ1, we found significant differences between participants' sleep patterns before and during the pandemic. The density plots here display sleep and work schedule measures over the course of a 24-hour day. The vertical lines indicate average pre-pandemic sleep patterns, the two dashed lines on the left, and average pre-pandemic work schedule measures, the dotted lines on the right. The solid vertical lines are a reference to the traditional 9-to-5 workday. As we can see, we found slight delays of roughly 20 and 36 minutes in sleep on and offset, and a moderate increase of 16 minutes in average total sleep time during the pandemic, which replicates prior work. On the right, we see that participants started and ended their workdays later during the pandemic, though they did not significantly increase their work hours. A follow-up analysis where self-reported sleep data during the pandemic were exchanged for wearable sleep data showed that the wearable sleep measures produced model results that were consistent with the self-report measures relating to sleep during the pandemic. For RQ2, we regressed the here shown outcome measures on study-long averages of bedtime and sleep duration, along with other relevant covariates. Teamwork was a combined measure that included the following team-related outcomes: communication, coordination, cohesion, and climate due to high correlation. Sleep duration predicted our teamwork measure, suggesting that participants who slept longer had a lower perception of team processes and team states. Longer sleep duration was also associated with lower perceptions of team productivity and positive affect. These results may point to the potential hampering effects of oversleeping in work-from-home teamwork. At the same time, participants who went to bed later reported higher team conflict and negative affect, which may indicate either sleep deprivation or possibly bedtime procrastination. For RQ3, we created a measure for sleep alignment, or rather sleep misalignment, because higher values represent more misalignment, by computing the average pairwise Euclidean distance of the study-long averages of bedtime and sleep duration. That means for each participant I in a team, we calculated the distance to every other participant J in a team as the Euclidean distance of bedtime and sleep duration. Average sleep misalignment in our sample was 1.65 hours, ranging from 0.49 on average for members of the least misaligned team to 3.73 on average for the most misaligned team. Looking at the models, we found that teams that were more misaligned in their sleep patterns reported higher teamwork. These teams also reported higher positive affect, but not higher productivity. A thematic analysis of interviews with members from the 5 most and 5 least misaligned teams revealed that those from the most misaligned teams were more likely to have explicit team working conventions and policies in place, and that they were more likely to have developed a collaborative mindset compatible and suitable with asynchronous remote work. We then tested sleep misalignment as a curvilinear predictor. We found moderate effects when predicting positive affect. Here, an average sleep misalignment of about 2 to 2.5 hours showed the highest association with positive affect. This may indicate a sweet spot below and above which positive mood may be dampened by factors such as too rigid or too lax work schedules in the team. Taking a step back, what are our takeaways when it comes to sleep alignment, and perceptions of remote teamwork and affect? Overall, our findings in RQ1 replicated prior work that has shown delays in overall sleep patterns during the pandemic. In RQ2, we found problematic sleep behaviors that may contribute to perceptions of teamwork and affect. Longer sleep was also related to lower teamwork and lower productivity. It is possible that participants who went to bed later or slept longer engaged in more off-hour work and had more difficulty coordinating their work with other team members asynchronously. Therefore, our findings suggest that employers may benefit from promoting healthy sleep habits, especially for those employees in full-time work-from-home positions. Another option would be to offer full-time work-from-home employees a health and fitness tracker for personal use, similar to the one we used in our study. Such an approach may circumvent any issues related to data privacy, as no actual data would be collected on the organizational level. When it comes to sleep misalignment, higher sleep misalignment may be an indication of more divergent work schedules. Under these circumstances, team members in more misaligned teams may have to put more effort into communication, coordination to have successful asynchronous collaborations. When sleep misalignment was included as a curvilinear predictor, we found a range above and below which positive affect dipped. Lower positive affect as an indicator of engagement may suggest lower active engagement among teammates and thus lower viability when sleep misalignment is either too low or too high. This study has shown the value that wearable sensors can provide in capturing biobehavioral data. However, such data like sleep are very personal and sensitive, and this raises significant ethical and privacy concerns even before questions on how such data may be collected in organizational contexts could be posed. For one, data inference problems are ever present in smaller sized teams, even if misalignment is only represented as the average sleep misalignment in a team. If data were still to be collected alongside basic and hassle-free options to opt in and opt out, average sleep misalignment scores could be generated for the whole team at regular intervals and used for reflection. The system could also notify teams in situations where misalignment lies outside the team's sweet spot and may negatively influence work-from-home collaborations. However, more work is needed to develop optimal privacy practices for biobehavioral data collected in the workplace. Thank you so much for watching. We encourage everyone to read our paper for more details and discussion. And if you have any questions, please feel free to contact me at tbreideband@outlook.com. Thank you.